You're listening to Inside the Village, where all news is local and no topic is off limits.
So help me, Bob, it's bully in the alley. Hey, bully in the alley. So help me, Bob,
Welcome to
it's
Inside
bully
the
in
Village, brought to you by True North Mortgage, where you'll get great advice and save a pile of cash. Find them online at truenorthmortgage.ca. Welcoming into the studio, Village Media Editor-in-Chief. What?
Was this wrestling?
We're just trying to give you a nice intro.
That's very nice. You did. All right.
You never give me one.
They don't let me do the intros. You do all the work.
We should do that one day.
Wouldn't be.
I'll ask the tough questions.
It wouldn't be good. I would screw it up. I'd screw up our sponsor every time.
I don't think you would. Michael Friscolanti, Editor-in-Chief at Village Media. We call him Frisco. I'm Scott Sexsmith. How are you?
I'm feeling great.
Yes, you are feeling great and feeling lighter. Now, we should point out we have been on hiatus for 2 weeks, and there's a good reason why. 2 weeks ago, at 1:01 in the morning, I believe it was a Thursday morning, you sent me an email, and the subject line was "struck gold."
Which could have meant anything, right?
I was afraid to open the attachment. I'm not going to lie, because I didn't know what
you didn't know what I was.
I didn't know where you were taking
at 1 a.m, eh?
But curiosity got the best of me, and I opened it up, and lo and behold, there was a picture of your discovered clippers,
yes.
which have been in a box because you guys recently moved. You haven't been able to find them. You did. Clearly, you were excited at 1 a.m. to email me, of all people. And Derek, if we can just flash a before and after of what Frisco did look like, and of course now what he does look like. Man, you clean up pretty good.
Yeah, but which looks better? The first one looks better.
Probably depends on who you ask.
Yeah. No, I do. I feel good. I feel like feel a little younger, a little smarter.
Yeah. No, look good.
Yeah, a little less like the guy in the Sasquatch Kid was looking for.
Yes, absolutely.
Made me think of that episode.
Your wife is probably the most excited and happy.
She's happy just because we're getting some more boxes unpacked. So it was an added bonus to find the clippers. But yes, it was interesting because I did an interview with Sault Ste. Marie's outgoing mayor, Christian Provenzano, and I'd actually found the clippers, I think, the day before or 2 days before.
Yeah.
And I actually thought, okay, I'm glad I have to eventually cut this thing.
Yeah.
So I feel a little more professional. I think some of the staffers here were looking at me wondering if it was just all fake, that I was really the editor-in-chief here, or just some guy they found on the road.
We never once, all right, maybe once, thought that. Anyway, good to have you back. Good to have you clean shaven.
Thanks, brother.
Let's get into it. The first word to Frisco. A great story out of Collingwood. A Syrian refugee who is living the Canadian dream has just opened up his own barber shop.
Yeah, I love that story. A gentleman who fled Lebanon, first fled the war in Syria to Lebanon, like so many Syrian refugees who came to Canada, made his way here. And it's one of the stories we're starting to see now, because it's been a few years, right, since the Trudeau government opened the doors to Syrian refugees at the height of the war there. And we're starting to see them settling and becoming Canadian citizens and opening their own businesses. We've seen it here in Sault Ste. Marie with Georgie Schwarmer, our great friend George. And we're seeing it just more and more, and it's awesome to see the benefits that they're receiving being in Canada, and the benefits that we're receiving, right? That we can go to a barbershop and there's a guy who fled the war in Syria and now is making a life in Canada. It's just a feel-good story, and I'm glad we're telling those stories.
Absolutely. Let's head to Sudbury. The Auditor General has just released her report on the situation at Laurentian University.
Yeah, if you read Sudbury.com, our site in Sudbury, and Heidi Ulrichsen has been on this story.
Yeah.
And I'm a journalist, right? And I love what she's done. She is on that story day and night, thinking about it, breaking stories on what's happened, covering it. And she was up early in the morning for the embargoed copy of this, like some other reporters would be as well, and bringing the news that the Auditor General was adamant that they did not need to go into creditor protection, and really pointing out some of the egregious spending and dumb decisions that senior administrators made at Laurentian. And it's kind of the culmination of the great work that Heidi did in some ways, right? As a journalist, when you follow a story like that for a long time and you're doing the ups and downs and you're breaking the news, there's that climactic moment when the big report comes out or a verdict comes out or something like that. And she just did a great job covering it for us and covering it for our chain. And it's just another example of the great local journalism we're doing, because people in Sudbury, and many people outside of Sudbury who went to Laurentian, they want to know what happened there.
Absolutely.
Right? So she's done a great job, and it really made us look good.
From Sudbury to North Bay, the U18 AAA North Bay Trappers hockey club involved in a fiery incident.
Yeah, you know this story well. And it's one of those breaking stories where Bay Today had it first, the video of the scene. This was a hockey team sadly it brought you back to Humboldt. It made you think of that,
Absolutely.
right? And so you have a bus. There were some, I think, tire problems, right? And so the team got off the bus, thankfully, and then it just went up in flames. And we have the video on the site, and they broke that news. What we discovered later was one of our reporters in North Bay, Chris Dawson, his son was a member of the Trappers. So very emotional for him to be on that story. And he came on your other show, Behind the Scenes,
Absolutely,
to talk about that. And I remember I watched it a couple of days ago. And just really powerful stuff because he's so professional. He's talking about it. Then you ask him about his son, and you just see what any parent would feel like, right? Like that emotion of like your kid, being involved in a pretty dangerous situation. What could have been a very dangerous situation, and his emotions came out. He was very honest about it. And it was just great. I mean, we did really well on the reporting on that story, and it's just nice that we were able to have a happy ending for Chris and his family.
And finally, to Sault Ste. Marie and some controversy surrounding a construction project.
Yeah, we're here in the Sioux, and a lot of people are talking about this. There's a new residential management withdrawal facility being built. The hospital, it's a facility for people dealing with drug addiction to get help. It's been a long time in the making, and there's a lot of people in the community asking questions about how funding came together for this. But essentially, a private owner bought the old Sioux Star building for about $1.25 million. And now the government, the hospital, via taxpayer dollars, is spending almost $18 million to renovate this building and then millions more to lease it. So essentially, this investor bought this building, and the government's paying millions of dollars to fix it and to lease it. And a lot of people are wondering, is that the best use of taxpayer dollars? How does this kind of deal come about? I'm not making accusations, but it's certainly one of those things when you shine a light on it, a lot of people are like, whoa, what's going on here? So Ken Armstrong at Sioux Today has been doing a lot of great reporting on it. He continues to do so, and it's a story where I don't think we've gotten to the bottom yet of what happened there.
All right, the first word to Frisco. Okay, coming up in our first segment, Dr. Michael Howlett from the Emergency Physicians Association of Canada is going to join us. We're going to talk all things healthcare and a pretty eye-opening discussion.
Yeah, I'm excited about this one because he's a really, really smart guy and really knows his stuff, and he's an honest guy. He really speaks from the heart. And when we booked him, I was really excited about it.
All right, Dr. Michael Howlett joins us next when Inside the Village returns.
From newsmakers to celebrities to other prominent guests, you'll find them all on Village Media's new interview series, Up Close and Personal. Join host Scott Sexsmith as he goes one-on-one with well-known Canadians to hear their story. Up Close and Personal. Look for it on your favorite Village Media website across Ontario.
Welcome back to Inside the Village, brought to you by True North Mortgage. True North Mortgage, where you'll get great advice and save a pile of cash. You can find them online at truenorthmortgage.ca. With Village Media Editor-in-Chief Michael Friscolanti, I'm Scott Sexsmith, joined on the line by Dr. Michael Howlett. Dr. Howlett is the president of the Canadian Association of Emergency Physicians. Doctor, good of you to spend some time with us today on Inside the Village. Thanks for that.
Good afternoon. It's my privilege. Thanks.
Now, Doctor, I guess the first question, we're entering into flu season, the potential of another COVID wave. More and more kids are ending up in the ER. I'd like to start by asking what keeps you up at night?
Well, what keeps me up at night with work is the austere conditions we're working under, with significant numbers of people that need to be admitted to hospital, plus our difficulty in finding nursing staffing in particular to take care of the patients. And it's really compressing the ability we have to take care of people easily. So unfortunately, that's a large phenomenon around pretty well all of North America and Europe, to tell you the truth. I have people I know in different countries that are having exactly the same problems. It seems to be particularly acute right now. And of course, coupled with the large number of admissions in the department, which is an ongoing problem and getting worse, right now we're seeing a big run on children with flu of various origins.
Doctor, you hit on a very important point, and I think, I keep hearing it or have read it that, the pandemic really exposed the state of the healthcare system and just showed the cracks that were in it. I don't know if you think that's 100% accurate, but it's true that we've known for a long time that the healthcare system was very overburdened. And I guess my question is, how do we even begin to fix that?
Well, it depends on whether you want to fix it short term or long term. I mean, the origins of it go back quite a ways, as you said, to where healthcare decisions were made to reduce hospital beds, to reduce nursing staffing, reduce physician staffing in the name of efficiency. Well, if you reduce redundancy in healthcare, eventually what happens is you end up with no backup when you run into trouble. And that's what happened with COVID and on these flu-like illnesses. We are now in trouble because we don't have any redundancy in the system, especially for elderly, frail people that we're trying to get out of hospital. So the short-term answer is we need very quickly to make our emergency departments in particular, critical care in particular, but also the healthcare system in general, a better place to work. We need to provide education for staff. We need to help our younger staff to feel more comfortable. We need to provide better education for them. We need to upskill them very quickly. And we need to do something to improve the working conditions so that people who are on the border of leaving will want to stay. No small task right now with the heavy workloads that people are taking on. I think longer term, medium and longer term, we have to increase enrollment in schools for nursing, for medicine, for personal care workers, for home care. We just don't have enough people in the system right now for the future. And we know that the problem with the elderly frail is going to increase over the next 30 years. So our ability to move people out of hospitals so that people who are acutely ill can get in, that's going to be maintained, and it's going to become an even more significant problem than it is now. So we're staring it in the face, and right now is when we have to start putting those systems in place.
I'm sorry for what sounds like a dumb question, Doctor, but can you even try to explain to us what that means for you on the front lines? All the things you've just described, what does that mean for you when you're trying to do your job and your staff are trying to do your job in an emergency room, for example, especially during COVID?
In practice, what it means is the nurses on the front line have to take on more nursing functions than usual because they're doing their usual emergency department functions, taking care of those people. Then they have to transition into taking care of admitted patients at the same time. And if some people are attempting to go home, they have to do long-term care nursing as well. So the nursing tasks are multiplied beyond the level of staffing that's available. So they eventually have enough distress that they decide they want to work elsewhere. When that happens, then the numbers of staff are reduced, and you have reduced staff taking care of increased patients, and it snowballs. And then what happens is, as the crowding increases and the staffing is reduced, you have the inability to put people in their usual places in the departments for care, and so you start having to see patients in chairs, on stretchers in hallways, sometimes going out to waiting rooms to see people, and so you're taking care of people in non-traditional areas, and it's very difficult to get good examinations. It's very difficult to do crisis interventions when you don't have the equipment at hand that you're used to having. Mm-hmm. And so it creates a significant handicap in doing what we've been trained to do.
Yeah. I don't mean to get into a personal story, Doctor, but I will for a minute. I dealt with the healthcare system a lot last year. I dealt with some cancer, and I was down at Mount Sinai Hospital for almost 5 weeks and for many months after for follow-up treatments. And what always amazed me was the staff that worked there under very difficult conditions and just the amazing things they did every day, their positive attitude. It was clearly a calling for them. It was not a job, and we've known that. We all know that nursing is a calling, right? And to see those people, and I guess the overwhelming thought for me was always, how could we not want to treat these people as well as we can and give them the right compensation for what they do? How much of this is dollars and cents, Doctor?
I think that to a certain extent, dollars and cents can help get you through a crisis. In the medium and long term, I don't think it's really the answer in terms of salary. People will be attracted to salary in as much as it keeps them in their role for a period of time, but then you need to do something else to improve their working conditions, to improve their ability to do their job. Otherwise, even if they're paid reasonably well, they run into this problem with emotional exhaustion and moral distress, and it becomes enough of a heavy lift that money in and of itself is not enough of an answer, to tell you the truth.
I don't want to oversimplify this, and forgive me if it sounds like I am, but in the example of a business, and let's say that revenue is down, you look for efficiencies, you cut staff. In a business environment, that may make sense. In this environment, it is literally life and death. And I don't know why that connection can't be made, that this is not just like a regular business where you look for those efficiencies and you can almost justify it. How do you do that when it comes to life and death? I just can't wrap my head around that.
Well, it's a conflicting problem, isn't it? It's the old equity issue, which is more than just efficiency, right? Efficiency means you do it, the least amount of cost for the best possible solution. Well, in healthcare, people want more than just what is the basic survival capability. They want to feel well. People want to be happy and comfortable in their lives. And that's more of an equity issue. That is, what is the trade-off between how much things cost and what people want for their sense of well-being, for their sense of health? I mean, that's a very large issue. And of course, that's then balanced by how effective we are. So efficiency in and of itself is not a good enough answer. I mean, you need to be effective in what you do as well. So sometimes fast, quick, cheap is not effective, right? Sometimes it can be effective and inexpensive, but it may not be what people want. It may be what people want, and it may be it may take a lot of resource to put it in place. I mean, there's a lot of that trade-off that goes on in healthcare. I mean, if you want to look at it this way, this is what I often quote to people: is there are three things in healthcare that people want. They want what they want, and they want it to be effective. They want it when they want it. They don't want to have to wait too long. And they want it for free. So in any given system, you can only have two out of the three. In the American system, quite often, you can have what you want and you can get it when you want. It ain't free. Yep. In the Canadian system, you get what you want sooner or later. You get it for free. You got to wait. And frankly, because we have waiting times, that is how governments control our system and its costs, by waiting times. It's going to be very difficult to control waiting times when that's how we limit the cost of the system. And I know governments will pay lip service to this waiting time reduction thing, but in actual fact, our system is designed not to improve waits.
Yeah, and let's build on that, Doctor, if we can for a second, the waiting times. Is that just a byproduct of a bigger issue and what's going on, and how do we fix it?
Yeah, well, waiting times is, again, it's the third pillar of those three issues. And I guess what I would like to see is good public transparency and good public discussion into what people really want out of their healthcare system and what society is willing to put into it to see it that way, right? Because right now, all the decisions around that are made by proxy by government bureaucrats, right? And by politicians. I'm not sure they're always the best people to make those decisions, especially on the equity basis. They tend to make efficiency decisions at the expense of the equity principle, or sometimes even at the expense of what's effective. We know, for example, hip fractures and hip surgeries for total hip replacements. We know that if you wait 2 years, the outcomes are not as good. But that's what we do. Right. So is that important to people? That we need to know that, and we need to know, we need to have the public able to make some choices about that. Right now, the public really doesn't get a choice about the priorities in healthcare. So emergency department care, critical care, is that a priority of society? Well, we've been highlighting for well over a decade or two that system is gradually crashing our emergency departments. Well, if that's what people want, if it's a priority, then it needs to be addressed. Right now, people don't seem to have much choice about whether it gets addressed or not. It's held by proxy by governments and bureaucrats, and they're making the decisions on the behalf of the public over what resources they want to allocate there. And any good business, if you get back to business principles, knows that if you want systems to work and if you want a new system to function, you have to invest in it. You can't create something from nothing. And for 20, 25 years, 30 years, healthcare has been doing healthcare reform by taking money from one area and saying, oh, we're going to reallocate it from acute care to preventive care. Well, I would argue that our preventive care is not much better than it was when I started in the late 80s, 30, 90, and our acute care is worse. And I've lived through it all, so I feel fairly confident I can say that.
Doctor, what's the most, you mentioned bureaucrats and government officials, what's the most frustrating thing that happens when you have a discussion with one of them? What is your biggest frustration?
I don't think we feel heard. I don't think they pay attention to us. I don't think they make decisions based on the experiences that the nurses and the physicians and those in healthcare are trying to bring forward. I don't think that there's an honest discussion with the public partners around those things. I mean, the easiest example to bring up is the health ministers' meetings, the national health ministers' meetings with the provinces. They meet, they provide no solutions over an issue that affects people's lives. I mean, there's good literature out there that show that waiting times in emergency departments, if they're prolonged, that the mortality rate goes up, people die. But that doesn't seem to register at a health minister's meeting. That doesn't seem to be what they're basing their decisions on. It's frustrating to not be heard.
And that's the stuff that every decision should be based on, you would think.
Yeah, I don't even know what to say to that, Doctor. When you listen to put in that way, it's hard to even say anything after that.
Well, I mean, you find that that's why people end up resigning from emergency department work and going elsewhere, is because they speak out and speak out and speak out and speak out and speak out, and they don't feel heard. So then they go elsewhere.
Doctor, if we can, I'd like to shift the conversation to masking for a second. Last week, I believe it was, Dr. Kieran Moore, Chief Medical Officer for Ontario, issued a recommendation that we should be returning to masks where possible. I don't believe any province in the country has it mandated. But my question to you is, what's your position on masking? What do you do when out in public?
Well, out in public and social, I mean, I was on a plane recently and I wore my mask most of the time. I think what's happening now is that there's public exhaustion with the isolation, the social isolation, economic isolation. And so it's understandable that people don't want to do it. I get that. The problem is, it's one of the only good ways we have of preventing transmission of these respiratory viruses. So, I mean, if people don't want a mask, the trade-off is more kids are going to get sick. That's the consequence. So, again, it's another public issue is, are we going to side with public irritation with masks? Or are we going to side with, let's see if we can reduce the number of kids that get sick and a few die? It's a hard point to get across.
Again, when you put it that way, it seems like an obvious answer. Do you feel like the province is making the wrong decision? Should there be a mask mandated in Ontario right now?
I think that in the circumstance, a short mandate to reduce the rate of infection is the time to do it before it runs amok. If you look at it from a public health point of view.
Yeah, and we've always looked at it from a public health point of view since the beginning of the pandemic. And I understand the arguments about the exhaustion and people are tired of masks.
Yeah.
I don't like wearing a mask either, Doctor. But I was just telling Scott. Well, you guys, I don't even know how you wear it all the time in your work. But Scott and I were just talking earlier. But at the same time, if the Chief Medical Officer of Health said we're going to issue a mask mandate, I would wear a mask because I understand the logic behind it. I guess I don't buy the argument that, well, people are exhausted. You know, maybe people are exhausted of wearing their seatbelts too. So we would not let them.
Where do you draw the line?
Where do you draw the line?
Well, that's the point. I think that, I mean, people don't understand the history of public health anymore. Like 100 years ago, 150 years ago, as people were discovering how these diseases were spread, isolation was the only way they had of preventing the spread of these diseases, right? And people knew that people with TB had to be segregated. People with infectious diseases had to be segregated when they were immigrating from other countries. Public health was understood and it was accepted. Nowadays, because we have such freedoms and individual priority on the individual freedoms like that, plus the fact that we've gone so many decades without major pandemics, without major infectious disease spreads that we couldn't treat, associated with deaths, because we've had so much of a good time, people have forgotten history. They've forgotten, that before 1900, half of all deaths were from pneumonia, right? People have they've got the feeling that doing what you want is the ultimate goal in life, and they've forgotten their duty to their neighbor and their duty to other people in society. And so the idea of how we use public health in society is lost on people.
And I think we turn to our public health officials to give us the real advice and to give us the real information. So I'm surprised that medical officials, not just in Ontario, but in other provinces, would say, we're all exhausted, we understand the exhaustion from us, so we're not going to issue a mandate. That shouldn't be one of their factors. Politics shouldn't be what they're thinking of. Shouldn't they be just thinking of the public health?
Yeah, I shoulda, woulda, coulda, I guess, is the answer to that.
But you know what I'm saying, right, Dr. Again, we're going in circles, but I worry in 2 months we're going to say, oh, yeah, we should have done it. Should have done a mask mandate. Look at all these people that are sick and dying because we didn't.
Yeah, well, I mean, everyone knows that decisions are rarely taken purely on principle, right? You get into difficult circumstances when you have two masters, right?
For sure. So speaking of questionable decisions, Doctor, I want to ask you, what do you say to people who argue with you about vaccines, who say that vaccines are poison and I'm going to die if I take this vaccine? What do you say to the anti-vaxxers who actually ask you about it?
Well, there's a couple of things. First of all, you can try to convince them of the evidence that it's effective. And that, the vaccines now, there's lots of evidence that they are among the most effective we've had in a long time. And the history of how we've reduced infectious disease in our society such that we've enjoyed in the last 50 years, right? We don't see polio anymore. We don't see diphtheria and tetanus anymore. We don't see Haemophilus influenza meningitis in small children. Those are all, that's a big deal, those things. But people have forgotten about those things. And so what usually happens when I try to address it, most of the people that I've talked to, just my own personal experience, who are anti-vaxxers, don't have a rational approach to the issue. It's usually based on emotive reasoning, if I may say so, without getting myself in trouble.
We can't promise anything.
Underlying logic behind their conclusions doesn't make sense to me. And so trying to convince them otherwise it's not an argument in logic. So I don't always spend a lot of time trying because, the old biblical principle of not throwing your pearls before swine, if I can say it that way.
You must feel some days like you're beating your head against the wall, though, and having those conversations.
You can, and some people can be really nasty.
Yeah,
that's for sure.
To a certain extent, you try to do what you can, and then you just got to let it go.
Doctor, is there anything that we didn't ask you or touch on today that you think our viewers or listeners would benefit from?
I think that people need to realize that their views are important and what they want in healthcare is important. And if they see it as a priority, society is going to have to speak up, because those of us internally who have been speaking up don't feel heard.
Well said. And Doctor, before we let you go, I think it's only fair to say that you should win the Zoom background award on Inside the Village. We've done a lot of these, and with all the crap going on in the world, you've got a peaceful looking place
That's right.
behind you. So thanks for sharing that with us, and thanks for doing this today. Dr. Michael Howlett, the president of the Canadian Association of Emergency Physicians. Doctor, thanks again.
Thanks again.
Reporters, editors, and journalists who go the extra mile to get the story and get it right. Go behind the scenes with those who cover the stories that matter most to you and your community. Look for it in the Village Features section of your favorite Village Media website across Ontario.
Back to wrap on another episode of Inside the Village, brought to you by True North Mortgage, where you'll get great advice and save a pile of cash. TrueNorthMortgage.ca is where you will find them. He was terrific, Dr. Michael Howlett. Very interesting perspective and insightful conversation.
Really enjoyable. It's always interesting to talk to somebody who deals on a regular basis with government officials. And, I hate to paint the stereotypical brush, right? But dealing with bureaucrats is not an easy thing to do. They're very set in their ways. The governments have been around forever. So here's a guy who's trying to lobby on behalf of his organization, who has worked on the front lines for decades, understands. I mean, imagine being an emergency room physician, right? Yeah. I wouldn't last 5 minutes doing that job. So it's interesting to hear his perspective and just how a lot of the people who've left the profession left out of frustration of not being heard. That's a pretty powerful statement to make.
Yeah, and the one thing that we talked about was masking, and where we've been and certainly where we're going, and it's interesting. You and I talked about this, that we're sitting in a room probably less than 6 feet away from each other, and I think that's why we delayed actually the start of the podcast, was for that very reason, that we didn't feel safe to be in the same. Well, I don't know if I'll ever feel safe to be in the same room. But that's it's a great example, and it makes you wonder where we're going.
If we had started this podcast when the pandemic first hit, we would have stopped the podcast, or we would have done it via home via Zoom like everyone else did.
Yep.
And I guess we're all kind of we're guilty of what he's saying people are doing. We're kind of saying, I'm tired of this, so I'm just going to barrel full steam ahead and just do it not do it. I think there's one person in our office I've seen wearing a mask, right, to their credit. And I was at a hockey game with a few thousand people on the weekend. I didn't see one person wearing a mask. So, like Dr. Howlett said, the recommendations can only go so far. The government's going to recommend something. It's like crickets. No one's listening to that, right?
And to your point about the person in our office wearing a mask, and has from day one, neither she nor her husband has had COVID.
See? She's also very smart, and the rest of us are not.
Just putting that out there. Looking forward to next week. We're going to talk coyotes.
That's what.
and not the Roadrunner and coyote, like the real thing.
Yes, yeah. And you know what? Coyotes are on everyone's mind. Everyone's thinking about coyotes because there's all these headlines all over the place about coyote attacks this and coyote bites this person. It feels like we're under siege by coyotes. So we're going to try to get to the bottom of it.
Yeah, it's going to be a good one. All right, thanks, pal. We'll do it again next week. InsideTheVillage.ca is where you'll find back episodes across the Village Media Network, and of course wherever you get your favorite podcasts. On behalf of executive producer Derek Turner, Michael Friscolanti, editor-in-chief here at Village Media, I'm Scott Sexsmith. Talk to you next week.
You've been listening to Inside the Village.
Frisco and Scott's Wardrobe, provided in part by Moores, Sault Ste. Marie.